frankly, 10 years ago, I was not looking for these as a cardiologist who deals with amyloid. But here again has come the value of systematic research, the value of actually doing systematic carpal tunnel biopsies or collaboration with orthopedic departments. For example, we have a collaborative program at Henry Ford between orthopedics and cardiology where systematic biopsies are done in bilateral carpal tunnel patients who have atrial fibrillation and heart failure to see if amyloid exists in the heart. So some of the important orthopedic manifestations that clinicians should be aware is bilateral carpal tunnel syndrome, and which precedes ATTR cardiac involvement by about 5 to 10 years. So asking that question in a patient who you're suspecting amyloid is very important. Spinal stenosis. These are kind of unique for transthyretin cardiac amyloidosis. Then biceps tendon ruptures, rotator cuff tears and surgery, hip and knee replacement, trigger fingers, and obviously any kind of knee issues that they have, or ankle issues. All of these, or a combination of these, in a patient with cardiac manifestations should make one think about amyloidosis.
Indication and important safety information. Indication. Attruby, acoramidis, is indicated for the treatment of cardiomyopathy, of wild-type or variant transthyretin-mediated amyloidosis, ATTR-CM, in adults, to reduce cardiovascular death and cardiovascular-related hospitalization. Important safety information. Adverse reactions. Diarrhea 11.6% versus 7.6%, and upper abdominal pain 5.5% versus 1.4% were reported in patients treated with Attruby versus placebo, respectively. The majority of these adverse reactions were mild and resolved without drug discontinuation. Discontinuation rates due to adverse events were similar between patients treated with Attruby versus placebo, 9.3% and 8.5%, respectively. Laboratory tests. Mean increase in serum creatinine of 0.2 and 0.0 milligrams per deciliter, and a mean decrease in eGFR of 8.2 and 0.7 milliliters per minute per 1.73 square meters was observed in the adults with ATTR-CM treated with Attruby versus placebo, respectively, at day 28 and then stabilized. These changes were reversible after treatment discontinuation. Use in specific populations. Pregnancy and lactation. There are no data on the use of Attruby in pregnant women. Animal data have not shown developmental risk associated with the use of Attruby in pregnancy. There are no available data on the presence of Attruby in either human or animal milk, or the effects of the drug on the breastfed infant or maternal milk production. Please see full prescribing information for Attruby at attruby.com/PI.